up, everybody? It's Freeman-Similien, SRN, and I'm making a video because I think I found my specialty. So, for the longest time, since the last video, and even before that, I was really a PCU girl, which is like the medical ICU step down unit. So, anyone who's like the sickest people in that hospital goes to the MICU, the medical ICU. Then there's the step down to that, which is where I used to love working, PCU, Progressive Care Unit. However, I learned because I floated and I was sent to the SICU step down. SICU is surgical ICU. So I did that step down and it was so much better. Like, not only are the patients happier, not that they're happy, but they basically went through a traumatic experience. They're not chronically sick. So they went through a traumatic experience, maybe a car accident. A lot of people have fallen out of windows. Um, some people have been attacked by police. I've seen all type of crazy stuff. I do work in North Philly, so you see some crazy things. So in the SICU step down, not the the thing that I like the best is that the nurses work together depending on who's on shift. But for the most part, you have happier nurses, you have more appreciative patients, and the patients that are really, really sick, I am so nice to them. They don't really bother me if they're grumpy because it's not my place to um, argue or get someone who's already in a compromised position more riled up or upset. That's not what I'm here for. That's not what I'm there for, and I never do it. But it's sometimes it could be really sad on the PCU when people are going to probably be sent back to the ICU, or sometimes they cold on that unit and they pass away on that unit, and postmortem care is done right there. So I still enjoy that. However, after working the SICU step down, I hope and I pray that my first position is there. The patients are still on monitors for the most part. The differences are a lot of things. You have your patients coming out of, gallbladder removal surgery or, spinal surgery. There's so many things to learn and to do, and that I just love it. And also, I have nurses on the PCU that I know who would have precepted me, and they are amazing. But there is this one nurse that works on a SICU step down that I would love to be precepted by because she's so in depth, and she's been doing it for like 30 years, and she's so nice, and she's so easy to work with, and she's so encouraging, and I could say a million other great things about her. And I'm really thinking about working there, and not only working there, but being precepted by her if there's a position opening. I no longer really care for the oncology transplant floor like I have told you guys in the past. I still do have an overnight to do on that floor this month, but it was more for the money than for the experience. So I am doing that unit once this month, but if I can get to the SICU step down, I'm working there. It's hard to get shifts for me all the time, but I've been looking like even all the way into April so that I can continue to build a relationship there. I think I have established a rapport there, and that's the specialty I want to choose. The reasoning, if anyone is wondering why, I am the type that when I go to work, I like to have a lot of things to do. I like to be really busy, and on that unit, that is definitely going to happen. And then you have your laid back Sundays on that unit, where the PCU is always crazy from 7 to 7. It's crazy. I can't walk after shifts, and it's because collaboration does not happen as often as the SICU step down. The nurses don't really help each other that much, and there's a very bad morale on that unit. And it didn't bother me at first, but then one day I was working, the day that I was sent to the SICU step down, I said, oh, let me go see my friends upstairs. And I went to that unit, and there was like 3 codes. All the nurses was all in chaos. I looked at the board. There was no nurse assistant assigned. So that's another thing. I don't want to be on a unit where they don't get the help that they need. Then you have your coworkers who aren't helping you as well. It's just an overall, it's not terrible, but it's an overall not ideal situation that I want to start at. And if I don't get a job there, I will definitely take like labor delivery, mother baby. It sounds totally different, but I will take anything but med surge. I will not start my career on a med surge unit. I know that a lot of people suggest that you do it. I don't enjoy med surge. I floated on Sunday in med surge. The nurses were great. The staff members were wonderful and nice, but the patients, I just don't belong there. I don't want to have 5 to 6 patients. I like the idea of people being really critically ill, needing more from me, doing wound care, flushing, pick whatever. I just like all of the excitement. Med surge, they're about to go home. Their lab values might be out of whack, but they're going home, and you're gonna send some of your med surge patients to ICU. They're gonna be critically care. And when I was there Sunday, somebody coded. Well, it was RRT, a rapid response, but um, my point is that I just don't see my personality for med surge. I just don't want it. So I will take NICU, I will take labor and delivery or mother baby just to not take med surge if I don't get the position I want at this hospital at the SICU step down. I will take telemetry floor. I would take anything besides med surge, and that I will. I want pediatrics, but like I told you guys before, pediatrics is not available at my hospital. And with my personality, I really think that step down units are perfect for me. And then after working there and getting experience, maybe I will do ICU in the future, but ICU is kind of depressing to me. You are saving people's lives, and not everyone dies, but there are going to be people who die, and I don't like the idea of post-mortem care. Um, I just think that step down is like my thing. So I just wanted to tell you guys what was going on. There's so much going on, and that's what I wanted to say too. I Now that I still work as a nurse extern, which is basically I do nursing assistant work, I realize like I need more responsibility. And that's good because I'm a senior in nursing school. I have like 70 something days left. And now in my position, it's kind of too easy. And I'm not saying it like, like in a cocky way, but I'm just saying it like it's too easy. So that means I'm ready to be an RN. I just have to finish this semester. We are mid semester. It is such a drag. I'll be honest with you guys. It is such a drag, but I'm almost done. And I just have to sit for my NCLEX after that, get my license in Philadelphia. It's not where I live, but that's where I'm going to be working probably. And start my career. I'm so excited about it. Nursing is definitely for me. I love it. I just feel when I'm at work now that I wish I had more responsibilities like passing meds, doing IVs, all the nursing duties that I can't do yet. I'm so ready and excited to do that just to see what an actual nurse does on her 12-hour shift. And I know it's a lot and I'm ready for it. And I think at this point, I should be ready for it. And I'm excited about it because I'm ready for it. So until next time, I hope this video, I know it's a little bit long, like almost 9 minutes, but I just wanted to give you guys a good update because it's been a few weeks and a lot has been going on. I've been working 30 hours a week as a nurse extern because I need the money, and also going to school, clinicals twice a week. And only days I really get off is Mondays, and then today's Wednesday, and I have a lecture day. So those are my 2 days to kind of like wear regular clothes and chill. So hope everyone else has a wonderful day. And again, it's Kiana Similien, SRN, and I'll come back hopefully with a little trick or something my next video. Thank you.